For people in the audience who might not have a medical background, can you tell us what the difference is between a shoulder separation and a shoulder dislocation?
Yeah, and that is a commonly mistaken diagnosis, because somebody will come into your office and say that they dislocated their shoulder, and actually they don't understand what that means. A separated shoulder is where the clavicle bone, which is the top knot basically on the top of your shoulder, connects to another bone called the acromion, and there are a couple of ligaments there, and when there's a certain amount of force, you can get either a pain syndrome or actually a rupture of the ligaments. Sometimes that can be surgical, sometimes not. Extremely common in hockey players, football players, and lacrosse players from getting hit in that direction. A shoulder dislocation, or its evil twin, the subluxation, is when the shoulder joint, the ball and the socket, actually dislocate, pop out, and oftentimes tear structures. That will then oftentimes give, especially in a young athlete and a contact athlete, an unstable shoulder, and that often does require surgery.
Now, you mentioned the clavicle bone when you were talking about shoulder separations. That's also a bone that is frequently broken in hockey players. Is that true?
Yeah, that's broken in hockey players. It's also commonly broken in cyclists and people who are kind of falling forward trying to protect their arm. And oftentimes that can be something that is easily treated with rest. But nowadays we're getting more and more aggressive on fixing these surgically, as we've learned through science that the anatomic nature of that bone is very, very important.